Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Biome edition. This audio podcast as part of a Labostix Vortex. This audio podcast as part of the Abstrax. This audio podcast as part of a Phantom newscast. This audio podcast as part of a Storm Labostix production. In this audio podcast, I look at abstract regarding an abstract in regarding to works from 2023. Looking at abstracts in regard to an abstract for the that have been put forward for the Americans a remit in regard to the American Society of Nephrology in 2023, looking at healthcare through audio and podcasts and art. Perspective on chronic kidney disease, CKD, a collaboration between the renal patient support group, the RPSG, and the kidney disease and renal support group, or KDARS group for kids, and Storm Labostix production. And so the abstract is as thus. Chronic kidney disease (CKD) is sort of recognized, if recognized at all, as a silent, irreversible, long-term condition, or LTC, and tends to establish itself as a health complication and or comorbidity. Healthcare service user access to educational support surrounding kidney care can be challenging between healthcare sectors owing to clinical environs. The sort of aims in around this as part of the sort of abstract. The aims were to understand how audio and podcast and art offer a collaborative basis for service users and service providers to align healthcare practices. The objectives, the objectives were where the audio and podcasts and art had been focused between two leading educational social media platforms to help highlight pertinent aspects surrounding healthcare and disease. In regard to the design, around this works, the audio podcast and art had focused on how healthcare professionals and healthcare service users could be working together through social media to improve experiences. In regard to the results, or at least part of the analysis, collaboratively between the RPSG and KDARS and Storm Labostix production, there is the usage of several social media platforms. The usage of several social media platforms, including four YouTube channels, and two SoundCloud channels, two SoundCloud channels, and over at the time of this abstract, or where this abstract was concerned, at the time, in regard to around 2023. At the time, there were two SoundCloud channels, and where there were over 600 audio podcasts and educational webinars highlighting context surrounding service users, surrounding service users and service providers, and surrounding nephrology, nephrology and pediatric nephrology, clinical medicine, and sort of around laboratory medicine, and biomedical, in regard to biomedical science. Audio podcasts and art can prompt service healthcare service user and healthcare service providers to join up healthcare. In regard to sort of the conclusions, the sort of aspects of the conclusion in this as part of the abstract, the RPSG is supports has been supporting over 10,000 healthcare service users amongst the adult renal population, and KDARS is and has been supporting near if not over if not over if not over service users, more than 2,000, near 2,000 or more than 2,000 service users, healthcare service users amongst pediatric and young people population. And audio podcasts and art can help incorporate practice excellence. Some main sort of terminologies that can be used, listeners, to identify similar literature or literature in around similar works, include social media, audio podcasts, online spaces, nephrology, and public health. That draws this audio podcast to a close. This audio podcast as part of a Biome edition. This audio podcast as part of a Labostix Vortex. This audio podcast as part of a Phantom newscast. This audio podcast as part of the Abstrax, and this audio podcast as part of a Storm Labostix production.